Hello everyone. Hi, I'm Jewel and welcome. Welcome to my channel. Some of you may have noticed that I took a little time off. I wasn't feeling very well, so I decided to unplug until I felt better, which I do. And of course, while I was resting, I was watching the television, and of course, it seems the coronavirus has have captured the world all over because people are very, very concerned about what's going on with this virus and what's going to happen next. So the National Kidney Foundation has some information for us. So the topic today is Be Prepared, Kidney Patient Prep for Coronavirus. This information, of course, is for all of those that have compromised immune systems, like us, people with kidney disease, and people that have had transplants, and of course, with people with cancer and all kind of underlying illnesses. So let's get started to see what the National Kidney Foundation has to say. Coronavirus is spread mainly from person to person. Older adults and people with kidney disease or other severe chronic medical conditions seem to be at greater risk for more serious coronavirus illness. Because of this increased risk for kidney patients, it is especially important for you to take action to reduce your risk of exposure. If a coronavirus outbreak happens in your community, it could last for a long time, depending on the severity of the outbreak. The Centers for Disease Control, the CDC, recommends these actions to reduce your exposure. These actions can slow the spread and reduce the impact of the disease. If you are at higher risk of getting very sick from coronavirus, you should stock up on supplies. Take everyday precautions to keep space between yourself and others. When you go out in public, keep away from others who are sick. Limit your close contact. Wash your hands often and avoid crowds as much as possible. During a coronavirus in your area, stay home as much as possible. It is important that everyone follow these preventive measures recommended by the Centers of Disease Control, the CDC. Stay home if you feel sick or have any symptoms such as fever, cough, sore throat, body aches, headache, and chills. Important note: if you are on dialysis, you should not miss your treatments. Contact your clinic if you feel sick or have any concerns. Avoid others who are sick, limiting face-to-face contact with others as much as possible. Cover cough and sneezes with a tissue, then throw it in the trash can. If you don't have a tissue, cough or sneeze into your upper sleeve, not your hands. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. If you don't have soap and water, use hand sanitizer with 60 to 95% alcohol. Clean very often the things that get touched a lot, like door handles. Avoid touching your face, especially your nose and mouth. Wear a face mask if your healthcare team or someone from the public health office says you should. Why do I need to prepare for the coronavirus outbreak? If there is a virus outbreak in your area, you need to decrease your risk of getting sick. It is important that you have food in your home. Here are some shelf-stable food choices to help you follow your kidney diet. Shelf-stable means foods that last a long time without spoiling, such as canned foods. It is important to prepare now by stocking up for 2 to 3 weeks worth of healthy kidney-friendly foods, fresh water, and medicines. This will help reduce your risk of infection by allowing you to avoid crowded spaces like grocery stores and drugstores. What about my dialysis treatment and or medical appointments? If you are a dialysis patient, you should not miss your treatments. If you feel sick, be sure to tell a member of your healthcare team. In the unlikely event that your clinic is closed due to an outbreak, your center will help you get dialysis at another nearby clinic. You can also visit www.kidney.org/help for up-to-date information on clinic closing and emergency resources. For early stage kidney patients or transplant recipients, contact your healthcare professional or nephrologist with any questions or concerns. Kidney friendly, shelf stable items for your pantry. It is important to keep shelf stable foods on hand to avoid getting sick if an outbreak happens in your area. Reminders: throw away cans that are open, dented, or past their expiration date to avoid food poisoning. Avoid using salt or salt substitutes if you have a potassium restriction. Keep distilled water on hand, bottles, or jugs. Dialysis friendly, low potassium, low phosphorus, low sodium foods, fruits, half cup, limit 2 to 3 servings per day. Canned or sealed container, no sugar added, drained and rinse. Applesauce is a good choice. Apricots, fruit cocktail, peaches, pears, pineapples, mandarin oranges, juices, which are cranberry, apple, grape, pineapple, fruit punch, lemonade, and limeade. Vegetables, the serving is 2 to 3 servings a day. Low sodium or no salt canned vegetables, drained and rinsed, which is bamboo shoots, beets, carrots, corn, green beans, mushrooms, pumpkin, sweet peas, and water chestnuts. For protein, you're looking for low sodium canned, drained, and rinsed food, which is tuna, salmon, meat, turkey, chicken, stable tofu, shelf stable, which is tofu, dried or no sodium added, low sodium canned pinto or fava beans, 1/4 cup, drained and rinsed, and of course, unsalted nut butter. For dairy, we're going to go with a half a cup a day, which is dry milk solids, evaporated milk, shelf stable milk alternative, refrigeration required after opening, rice, soy, or almond. Grain, which is bread, white, light rye or sourdough. Dry cereal, unsalted, puffed wheat or rice. Avoid bran and high fiber. Good choices include, but not limited to, cornflakes, honey bunches of oat, life cereal, puffed rice, Rice Krispies, Special K oats and honey, cooked cereal, cream of wheat, or grits, white pasta, white or brown rice, unsalted crackers, and for fats, you're going with unsalted butter or margarine, low sodium mayonnaise, single packet, vegetable oil, olive oil, canola oil, sweets, animal crackers, chewing gum, graham crackers, hard candy, jelly beans, vanilla wafers, other, which is honey, jelly, and jam. These are all low sodium foods that you may want to have in your shelf just in case there is a corona outbreak in your area, and to always make sure that these foods are on hand because you really never know what's going to go on. So, guys, this is Be Prepared Kidney Prep Patient for Coronavirus. This information is coming from the National Kidney Foundation. And for everyone that has found this useful information, please like, share, and subscribe. And as always, always sending you so much love, so much affection to let you know you are not alone in this journey. And for everyone that is, have kidney disease, if you are having any issues at all, or you want more information, always call your healthcare team and your nephrologist, and they will let you know, what you need to do, of course, and how you need to go about things. So guys, of course, the only thing that we have to do, of course, as kidney patients is always be compliant with our doctor's orders. Always know that there's so many people out there in the background that are trying to bring our health to to the optimum level. And all we have to do, all we have to do, of course, is just to be prepared, like this article says, for anything that comes up. So, guys, take care of yourselves, and I will see you on the next video. Bye.